Hello everyone, good afternoon and welcome to this webinar. I'm Dr Sara Long and I'm a researcher in child health and wellbeing at the Decipher Research Centre, and I'm going to be talking to you today about some of my research into the Wales-wide school reforms. So before I go into the findings of the research, I want to highlight that the findings that I will be talking to you about today form part of a larger research study. To be specific, I was funded by Welsh Government to carry out a 3-year fellowship project, and this fellowship has 3 components or 3 individual research studies. So the first is what I'll be talking about today, and this is essentially about understanding the aims and processes of school reforms with a particular focus on health and well-being. It's about the second research study will be about developing a framework for an outcomes evaluation of the impacts of the reforms on pupil health and well-being. So this will involve using existing data to look at pre-reform trends in health and well-being with a view to doing a longer follow-up study, if you like, or several follow-up studies to look at impacts over time, probably over the next 5 to 10 years. And the third research component, which will be happening in the 3rd year of the fellowship around the time of rollout of the reforms, is about understanding school staff perceptions of and preparation for rollout of the new curriculum. So that will involve case studies in schools across Wales. So component 1, which I'll talk about for the duration of this webinar, had 3 aims. So the first aim was about exploring the changing role of schools over time. The second was about understanding the aims of the reforms in general, but with a particular focus on the health and well-being aims. And then the third aim is about understanding feasibility and acceptability of the aims of the reform and the implementation processes through which aims might be achieved. So how can schools operationalise this? What can they target to get this right? And I carried out interviews with senior stakeholders in the Welsh education system. The interviewees included individuals from organisations such as Estyn, the consortia, those involved in the development of the curriculum in Welsh Government, as well as those involved in professional learning. And also from I interviewed people from organisations that straddle health and education, essentially. So, for example, Public Health Wales. And I carried out something called a thematic analysis, which basically means analysing the interview data, summarising it and creating a coherent structure of themes to describe your findings. So here is the structure. So my research found 3 thematic areas. So the first is about the changing role of schools over time in the current landscape. And this essentially describes how and why schools have changed, in response to what, and what schools' current roles are. And I'm only going to mention this briefly because the main focus of the rest of this webinar is going to be on the future role of schools and reform aims. This second thematic area obviously builds upon the first, in that some of the roles that schools currently perform will continue into the new world as well. The third thematic area is about the complex space between vision and success. I won't go into detail on this today because I'll be talking about it in a separate webinar that will be aired next week. But essentially this covers things such as the accountability framework and getting professional learning right, and work with external partners and organisations. So I'm just going to briefly mention the changing role of schools over time and the current landscape. This included themes such as a change in society and increase in expectations. And within this, you have this kind of, with the introduction of the national curriculum, the increasing focus on performance metrics, and also changes in light of new evidence, such as new evidence and new laws, for example, around child development and children's rights and mental health and well-being and so on. Obviously, schools have a role to play in health and well-being, but that role at the moment is variable and fragmented with PSE. And we have this idea of an inextricable and synergistic link between health and well-being and performance. So this is something that it's a narrative and an evidence base that's well established in the health arena, but increasingly this link is recognised more and more in education, and it's, you know, you can't ignore it, that learners and also adults who have good health and well-being perform better across the board. Obviously, schools have a role to play in safeguarding, and there's this idea that schools are high-pressured environments, and there's an expectation management issue around what can be achieved by schools in any given time frame, and I'll say more about that later. So that's the first thematic area. There is more detail, but for the purpose of this talk, I'm going to talk about the aims and goals of the reforms. Okay, so the first aim is around using education and learning as a means to achieve policy targets. So schools have a role to play in helping society achieve wider policy targets, whether that is around environment and climate change, crime and security, or, as I've mentioned, health and well-being. There may be variability in acceptance or perception of exactly what this role entails, but there's increasing emphasis from Welsh Government that schools have a role to play. And the fact is that the majority of children spend a significant amount of time, of their waking time at school. It's around a third of their waking time. And so schools provide a significant vehicle for change and impact in a wide range of policy areas. I'll just give you a few moments to read this quote. Okay, so that's the first aim I'm going to talk about. The second is about essentially, so part of the, what came out of interviews is that part of the transformative agenda is about placing emphasis on the fact that there is life beyond exams. So of course, the core business of schools remains to be literacy, numeracy, and so on. But the role of schools goes way beyond providing an education in traditional subjects. And there's variability in the way that schools do this at the moment. You know, it's kind of recognised that in developing well-rounded and balanced individuals that can contribute to the economy and be contributing members of society, you know, there are a wide range of skills and abilities that are important, but that might not be currently valued or prioritised in the national curriculum or the current accountability framework. And it's also about recognising that, you know, wider life skills are becoming increasingly important in determining success. So, you know, regulating emotions, confidence, self-esteem, presentation skills, these are all things that employers are increasingly demanding, but that fall into, I guess, the health and well-being arena, but are crucial for performance in a wide range of other areas as well. And it's kind of highlighting that employers are increasingly describing a deficit in skills when learners are entering the workforce. And there's something there about shifting the balance and placing important on these other things that have not traditionally been classed as core subjects or core skills. I'll just give you a minute to read this quote. Another aim is about creating an individual needs-based approach to the curriculum and beyond. So there's this idea that a practitioner is not a teacher of a curriculum, but a teacher of a child. It's a kind of a child rather than a subject-centered approach. And this is particularly relevant for health and wellbeing, where different contexts, different schools, and learners within those schools will have different needs. The idea was discussed that the current focus on attainment metrics, as I've alluded to with the introduction of the national curriculum, we saw this increase in focus on attainment metrics, can sometimes come at the expense of teacher-learner relationships. And, the idea is that in the new world where schools and practitioners will have more autonomy and freedom, they will also have more scope to focus on the needs of individual learners. And I've got a theme on autonomy and freedom, so I'll say a little bit more about that later on. And it's essentially, having this individual needs-based approach is about part of it is about enabling learners to fulfill their potential regardless of their academic ability. So it's about recognizing and nurturing those differences in skills and abilities, and valuing those other, valuing the skills and abilities with the arts and with music and in other areas in a way that hasn't perhaps always been done before. Okay, so another aim of the reform is to create a new direction for health and wellbeing. So this is about going beyond the sometimes tokenistic PSE, and it's about giving health and wellbeing gravitas and placing it at the top of the agenda, essentially. So, and this is a generalization, and there are several generalizations that I will be making, but there's acknowledgement that at the moment in the system, there's a high level of variability in quality of delivery of health and wellbeing initiatives. It was described how focusing on, rejigging the PE department, focusing on physical activity would do the health and wellbeing agenda and the reforms a big injustice. Participants alluded to the idea that where there were time pressures, for example, health and wellbeing may have been deprioritized or displaced, but with the new curriculum, the reforms and in the new world, this won't be possible. And there was the idea that health and wellbeing could be conceived as having two priority areas. So the first is around equity, and that includes the needs of vulnerable learners. And that's about tailoring approaches to individuals dependent on their needs. And then the second priority area is, could be conceived as being around progression through the health and wellbeing curriculum. And that's something that would be universal. And in the new world, it's about moving past the idea of either health and wellbeing initiatives or delivery of education in your learning in your core subjects. There was recognition that earlier I described a theme around this synergistic link between health and performance, but it was also recognized that this dichotomy does still exist in some areas and is reinforced by the current accountability framework. And it was described how, obviously, health and wellbeing is new and doesn't have the same history of being taught and assessed as some other subjects. And it's a new area for most teachers and is perceived as more challenging and more complex. And in reality, it probably is, because it is new. And that professional learning hasn't really been there up until now. So it's about getting the professional learning right, which I will say more about in my next webinar, but something that was described as having the potential to be problematic was if old material such as home economics or PE is rebirthed and repackaged. It was described how this wouldn't capture the essence of the reforms and the new health and wellbeing agenda, and could lead to practices going back to how they were before, which would mean that the education system isn't able to deliver on the vision it has around health and wellbeing. Okay, so another aim is about creating this cross-cutting knowledge, skills and experience-based curriculum, and in the case of this particular talk, area of learning and experience. And this is good news for employers, because as I've alluded to, they've been describing a lack of applicable skills when learners are entering the workforce. And I think the idea of a knowledge, skills and experience-based curriculum is where things such as the whole school approach can really come in and have an impact. So, you know, throughout the interviews, there was consensus that you can't address the health and well-being needs of learners simply by delivering lessons and delivering knowledge around health and well-being. There was the idea as well that health and well-being can be weaved into other subject areas to give a more rounded and holistic learning experience. And actually, some interviewees advised against delivering health and well-being as a standalone subject. The essence of the reforms, the reforms are designed to allow integration of different learning across the AOLE subjects and allowing the AOLEs to be intertwined. The new curriculum will also be purpose-led. So again, that means that there should be more integration and coordination across subject areas, because you are delivering to achieve the purposes rather than to achieve learning in any one particular area. I'll just give you a moment to read this quote. Okay. So going back then to the point about, or the theme that I briefly mentioned earlier about schools becoming, you know, there's a lot of pressure in schools, they're high pressured environments. That, you know, kind of combined with a backdrop of increasing mental health issues and a fast-paced and rapidly changing society, you know, all of these things combined essentially potentially have led to this increase that we're seeing in reporting of mental health issues. And also there's been normalization of you know, addressing mental health and talking about mental health in society as well. And essentially all of these things combined have led us to the point where, you know, we need schools to respond essentially. And this is where things such as a whole school approach to mental health and well-being can come in. It's about schools knowing the mental health and well-being needs of all their learners so that they can make those necessary adjustments and dispensations for their learners. And the other thing I want to mention is that there's increasing recognition of this important link between mental health and well-being and wider performance, as there is with physical health. You know, and as a society, we need people who are resilient and who are able to bounce back. And with this increase in mental health issues, this is particularly important. Okay, so another aim of the reform is about providing schools and practitioners with more autonomy and freedom. So as I've alluded to, schools have become more restricted and mechanic, I suppose, in recent years with the introduction of the national curriculum and performance metrics. And the reforms, the essence of the reforms is about changing that. So this will essentially involve a change in position from, I guess, passive didactic curriculum-led teaching to a more active agency where practitioners are becoming curriculum designers. As with everything, this is a generalization, but essentially it's about moving practitioners from passive to active agents. That's a really simple way of putting it. And there's recognition, I suppose, in the system that this creates worry and uncertainty. It's change, and it's a big change. So I asked interviewees about how variability will be managed, and at the time that I carried out the interviews, this wasn't finalised. Of course, we have the legislative framework in place, making some aspects of the curriculum mandatory. You know, but it's complex. It's really, really complex. When it comes down to the, you know, like I said, some parts are mandatory, but when it comes down to details and the methods, there will be variability, and there's going to be variability. The reforms are designed to allow variability, for example, in the delivery of health initiatives, depending on need in a particular context. I guess the flip side of that is that more autonomy and freedom could lead to high levels of variability in implementation and also outcomes, which could have a negative impact on equality. It's this idea that when you liberate a system, you remove a ceiling, but you also remove a floor. Other issues that were described was with this autonomy and freedom, you know, how do you kind of manage that engagement and that practitioner buy-in? So it's essentially that there's an issue there around engagement, which again, I'll say more about next week. And also this autonomy and freedom could be associated with inconsistency in the delivery of health and wellbeing initiatives. But again, the essence of the reforms is about enabling localized solutions to suit schools and learners' particular needs. And I think it's really important to recognise that there's more, as described throughout interviews, there's more than one way to implement this correctly. It's important for practitioners in this new space to be thinking critically and asking why. And essentially, I'll leave you with a quote to illustrate what that means. Okay, so schools have a role to play in equality. So before I go into detail on this theme, it's important to point out that it's complicated and it's difficult to disentangle the impact of schools on equality when there are a whole range of other factors such as policy measures, family and peers that can have an impact on learner outcomes and equality. Having said that, schools, as I've mentioned earlier, schools are a setting where learners spend a significant amount of time, and schools can have an impact for better or for worse. And this theme is essentially about exploring how that might happen. Again, just to reiterate, there's an expectation management issue. You know, the role of reducing inequality can't and shouldn't be placed at the role solely at the door of schools. Okay, so in the context of learner outcomes, it's really important to prevent the inequality gap from widening. If the new curriculum is implemented correctly, then actually what we should see is a reduction in inequality through tailored learning, through being able to adapt the curriculum and adapt learning to individual learners' needs. Also, you know, with the increasing prioritisation of health and wellbeing in the new world, there will be universal access to health and wellbeing learning, which otherwise wouldn't have been available. And essentially, this will mean that some learners that they may not have met the threshold for intervention in the current system, but they will receive that learning in the new world. And so, again, this is a mechanism through which inequalities might be reduced. And there's something around, with changes to society that these are changes picked up during the interviews that I haven't gone into today for because of time. There's this idea that with changes to society, schools are increasingly filling a vacuum or bridging a gap in learners' knowledge as they come into the learning environment. And essentially it's about schools providing, I guess, learning where those skills may have been missing from home, and filling that void, I guess, between the home environments and society. And it's kind of, you know, this idea that some schools are serving communities with really high levels of deprivation and adverse social conditions, where children are coming to school with behavioural issues. And there's this idea that these things need to be addressed before learning can happen, because until those things are addressed, the children are not able to learn. Equality was also discussed in the context of schools not being at an equal starting point, and this raised the issue. I carried out interviews over a year ago, but at the time of interview, this raised the issue of providing different levels of support or different support packages for schools depending on where they are on their journey at the moment. So that's something that when I'm writing up, I'll need to follow up because I'm not sure where that's at. Equality and assessment was also discussed, so ensuring that progression criteria are suitable for all learners, including vulnerable learners. I'll just give you a minute or two to read some quotes. Okay, there's just 2 slides left, so around 5 minutes. Okay, so over time, there's been a significant increase in the sort of demands and expectations placed on schools and practitioners within them. And as I've alluded to, it's really important to be realistic about the complexity of influences on learner health and well-being, and essentially what we can realistically place at the door of schools. So there's an expectation management issue there that can potentially be addressed through stakeholder engagement. It's important to manage expectations among practitioners and school staff about what they can achieve and in what time frame. So there needs to be room for trial and error, room to make mistakes, room to see what fits in their particular context. Perhaps most importantly, we have to avoid drawing conclusions about the impacts of the reforms too quickly. So, you know, children who fully experienced the new world, the new system from the ages of 3 to 16 won't have finished school until the 2030s. And when you just think about that, you know, that it's a long time, and we might see effects in primary schools sooner on or in younger cohorts in secondary schools, but actually it's really important to play the long game here and carefully consider when we expect to see impacts on outcomes and process measures. And these quotes illustrate this kind of expectation management idea. And the second quote just highlights the importance of stakeholder engagement and managing expectations with the wider public about when we might expect to see changes and impacts, because, you know, I guess negative publicity from the media has the potential to create, I suppose, negativity in the workforce and potentially create a demoralised workforce. So there is an expectation management issue that's going to be ongoing. Okay, so I asked interviewees questions about what the positive impacts of the reforms would be for learners, schools and society. And I've split the kind of outcomes, I suppose, that interviewees described into two areas. So the first is kind of your longer term impact. So what are we expecting to see in terms of changes for learners, schools and society? And then the second category that I've created is about process level measures. So things you might expect to see changed within the school system in a shorter time frame. So that might be things such as, integration of health and wellbeing throughout the curriculum, or the amount of time that's given to health and wellbeing, or professional learning, and how much of the workforce is dedicated to professional learning. So I'll say more about those in a minute. But thinking about the outcomes, what came through loud and clear was this idea of the 4 purposes. So, your healthy, confident individuals and so on. But then when you try to unpick that, it becomes quite tricky. And it's very difficult to summarize all of the outcomes that interviewees said would be impacted. But I've done my best. I could spend an hour talking about just the impacts. There's a lot there to unpick. But for learners, when I dug down into it, it was suggested that learners will see improvement across a range of outcomes, such as physical health. So, your kind of, your physical activity, but also your health complaints, mental health and well-being, digital well-being, resilience, happiness, confidence and kindness, empathy, adaptability, decision-making, social cohesion, school attendance, school connectedness and peer support. And all of this would have a kind of knock-on effect in the use of specialist services, such as smoking and mental health and NHS services. And we will also see people coming out who have transferable skills for entry onto the workforce and to last a lifetime. And learners essentially being better equipped to deal with the demands of the 21st century and able to fulfill vocational pathways as well as academic. For schools, there would be less pressure, more autonomy and freedom to adapt to local context, which of course is also beneficial for learners. Improved teacher health and well-being, absenteeism, behaviour, school connectedness, exclusions, antisocial behaviour, equality, education experience, and there are many more. And it was described how this should be for all schools across Wales, including those from impoverished areas. For society, we will see a more able, efficient and effective workforce, less antisocial behaviour, better economic outcomes, universal provision of health and well-being, and a possible reduction in inequalities. So thinking about, I've touched on the process measures, but some other things that might be included in that include school connectedness and relationships, engagement with stakeholders and external partners, individual engagement and professional learning, needs-based approaches to learning, engagement and alignment with the employment sector. And the final point is just about measuring success for health and well-being. So we have mechanisms, we have larger mechanisms that are available to kind of measure the impact of the reforms on health and well-being. Something that was alluded to throughout the interviews was the idea of a health and well-being GCSE, and this is something that is still, there's ongoing discussion around this. There were really polarized views on it. So some people were really against it and other people were for it. So, I guess there was this idea that a GCSE in health and well-being would enable that kind of specialist learning, which would lead to more learners going on to with skills to apply in in health professions. But this idea that you could measure the impact of the reforms on pupil health and well-being with a GCSE was very, very controversial. So how do you assess an individual learner's health and well-being by asking them questions through a GCSE? So that was very interesting. And as I said, that's something that's still up for discussion. It's currently a consultation out that we as a research centre will be responding to. And that's it really. So the last thing there is about the potential use of school level data to look at the impacts of the reforms. But as I've mentioned, these things are to be decided. So thank you very much for your time. I could continue talking, but I am told that I need to finish now. So I will do so. Good to have your attention, and take care, and I'll be available for questions. Thank you.